time for my interview with Shadow Armed Forces Minister Luke Pollard. We discussed Labour's policy issues, the big ones, I think, anyway, some of them, including taxes and the NHS. Look, we did kick off with D-Day. What we'll say is just listen carefully for a couple of things that he says when I ask him about the NHS and private health care, and just make your own minds up about this. So this is the interview. Mr Pollard, today marks the 80th anniversary of D-Day, a vitally important date in our nation's calendar. Sir Keir Starmer stuck around for the international leaders ceremony. Rishi Sunak flew home to hit the campaign trail instead. Is that a sign, do you think, that Sir Keir thinks he's got this election in the bag?
Oh, no, absolutely not. There's no complacency from Labour in this general election. But I think it was good that Keir stayed to be there with international leaders. D-Day is a really important date in our calendar, especially the 80th anniversary, because we're running out of D-Day veterans, those people who stormed the beaches or who dropped in parachutes behind enemy lines. There's less and less of them every year. That's why it's so important, I think, for D-Day 80, that we not only remember the sacrifice and the service of those who were participating in D-Day in the Second World War, but we also tell the story to the young people for whom this seems like a very long time ago, as to why it matters, why it's so important that we remember that generation of people who served our nation, and why we should tell their story and how important freedom and liberty is today.
No, absolutely. Well, a lot of the parties, including your own, took the opportunity on D-Day to announce veterans or armed forces policies. As I understand it, Labour is committed to setting up a new commissioner to speak for members of the armed forces. With respect, isn't that your job? And also, is there a bit of a trust issue when the last Labour government issued letters of comfort to the IRA and did also pursue historic prosecutions against some of our own armed forces?
No, I think it's really important that we have an independent voice for our armed forces. We've seen over the last 14 years that morale is falling. We now have huge problems with retention and recruitment. And that's why we want to tackle that with an independent person able to inspect military facilities, deal with complaints, to listen to those who serve and, importantly, their families, and to investigate things like kit, the poor state of military housing, and then report directly to Parliament, not to ministers. We want to increase accountability because our armed forces are the best in the world. But frankly, the system and support they're getting at the moment isn't up to scratch. That's why we not only want to increase defence spending to 2.5% and give our troops the equipment they need to defend and deter any aggression, but we also want to make sure that we're renewing the contract between those who serve and the nation that's been so eroded over the last 14 years.
OK, all right. Now, sources have told The Guardian today that Labour shadow cabinet ministers are calling for Rachel Reeves to raise capital gains tax to fund some of your policies. Are you one of those people?
No, Labour's been quite clear, and Rachel's been very clear on this, that we have no plans to raise income tax, national insurance or VAT. There are certain areas where we have already set out where we want to change the tax rates to support public spending, such as closing the loophole on private schools to support our state school sector, hiring 6,500 new teachers and making sure we're getting mental health support for kids in secondary school in particular. We've been very clear about where there will be a tax change, but I'm afraid the scaremongering that we're seeing from the government over the last few days is not consistent with what Labour policy actually is.
So you don't want to raise capital gains tax then?
No, Rachel Reeves will set out all the tax changes if we get elected in the budget, but we've been very clear that except in the circumstances that we've already set out, and that will be in our manifesto in the next few days.
Because there are some concerns. There are some concerns about that, because there's another source that's also leaked to The Guardian, which says that Rachel Reeves is planning what's called a kitchen sink tactic, which is that if you guys are elected, and it's looking that way at the moment, that she will have a look at the finances, say that they're in much worse shape than she ever imagined, and then lob a load of tax hikes out there in one go. I mean, she's been rumbled there, hasn't she, really?
Well, I haven't seen these leaks that you're commenting on here, but I think one thing about your question is right. we are potentially, if we win this general election, inheriting a really poor set of public finances. We're inheriting public services that are on their knees. Everything seems broken. That's something I hear on the doors when I'm out canvassing quite frequently. That's why we've set out clearly what we can do and where the money is coming from to pay for it. So I think trust in politics is really through the floor, and big promises of big spending, I don't think will wash with the public. That's why we've been careful not to make any unfunded spending commitments. We've had £71 billion of unfunded spending commitments from the Prime Minister, but we're not doing that. We're saying clearly we're making changes here and it'll be paid for by this. And that, I think, is the right approach to win trust of people in this general election.
OK, now, look, just one last one with you. If you did have a loved one who was on an NHS waiting list, would you advise them to go private?
No, I believe in the National Health Service. I always have. In every job that I've had, if it came with private health care cover, I've asked to be opted out of it. I believe in the National Health Service because I believe you should be treated about your health, not about how much money is in your pocket.
I do just want to emphasise that because I just want to make sure I didn't mishear that. So if you had a private healthcare policy through another job, right, you would ask to opt out of that private health. So you conceivably for yourself would rather spend a year on an NHS waiting list waiting for a lump or a bump to be checked than go private and get that looked at next week?
No, I support the National Health Service. And indeed, I've had a lump and a bump checked out in the last year. I've had skin cancer on my face just here. And the National Health Service not only identified it, but they treated me with it. Superb NHS staff working their socks off. That's one of the reasons why, as a party, we're setting out we need to take down that 8 million people that are on that NHS waiting list by 40,000 extra weekend and evening appointments every week. It will take an entire parliament 5 years to wear down that incredibly high waiting list that are getting worse and worse under the Conservatives. But I believe in the National Health Service. I believe that you should get your healthcare at your point of need, not about how much money you have in your pocket. And that, I think, will support everyone be able to get the healthcare that they deserve.
Do you think that for some people it's not offensive to NHS staff that they might want to go private? It's that people have at times had quite poor care on the NHS, or it's taken far too long for them to get that care, and that because they do actually love a relative and they can maybe afford to, they might go private. And do you think it's maybe offensive to people who do that to be saying some of the things that you've said there?
No, I believe in the NHS. I believe that we've got a choice in this country about how you want to provide your healthcare. I think everyone should have access to a decent National Health Service in their area, not only for a big hospital with big cancer services like we've just discussed, but to make sure they can access a GP and an NHS dentist. And primary care, NHS dentistry is on its knees under this government. That's why we've also set out plans to rescue NHS dentistry with more appointments and more dentists, and make it easier for people to see a GP. Because at every stage of our NHS journey here, there's a real crisis. It's not because people in the NHS aren't working their socks off. They really are. It's that there hasn't been the investment or the thought that's gone into this by ministers.
All right. Luke, thank you very, very much. It's been great to have you on the show. That's Mr. Luke Pollard there, who is the Channel Minister for the Armed Forces. Thank you for your time today.